My name is Leanne Sherrod. I'm a speech-language pathologist and the president and chief clinical officer here at Expressible. Thank you for joining me to learn how to support your child in their speech and language growth. As a speech-language pathologist, I know how important it is for children to be able to express their thoughts and speak clearly and confidently. It's true that all kids are unique and develop at different rates. But as they learn to speak, children typically follow a specific progression of sound development. We call a child's ability to make specific sounds articulation. And while some sounds are easier for children to make, others are much harder and develop later in life. Some of the earliest sounds in English that emerge are b, p, n, and d. Some trickier sounds like the s and sound develop later in life. As children get older, they should be consistently increasing the number and types of sounds they can accurately say. For example, while a young toddler might be limited to words starting with a B and P, by 5 years, most children can correctly say the S and R sound. It's completely normal for children to pronounce sounds incorrectly as they're growing up. They may substitute one sound for another, for example, swapping the W sound for an R sound and saying wice instead of rice. Or they may add and omit certain sounds altogether, pronouncing nana instead of banana. While these mispronunciations can be considered cute in young children, they can potentially lead to serious issues if they continue as children age. Age-appropriate articulation is important for a few reasons. First, it helps children communicate their thoughts clearly with others, and it ensures that others can understand them. Second, practicing articulation skills early on will make it less likely that speech problems emerge as they get older. And last, articulation is critical for safety. If a child is ever in an emergency situation, it's especially important that they're able to communicate clearly. While certain sounds can be tricky for kids to learn, they are certainly attainable. Some sound errors that are developmental or based on your child's age will go away on their own, but others will not, and they need to be treated by a speech-language pathologist. Here's the good news. With appropriate speech therapy, many children with articulation problems see major improvement in their speech abilities. So let's take a minute to recap what we've covered here. As children get older, they should be consistently increasing the number and types of sounds they say. This is called articulation. Age-appropriate articulation helps children communicate clearly, and if kids practice their articulation skills early on, they're less likely to have speech problems when they get older. There are many reasons certain sounds can be tough to master. However, the more you understand what makes them difficult, and where your child may be struggling, the easier it is to make an informed decision about their care. In many cases, this involves receiving professional support from a speech-language pathologist. They'll create a treatment plan that's tailored for your child's specific needs. Your speech therapist will work to identify and fix sounds your child is pronouncing incorrectly and help your child practice sounds in different words and in longer sentences. They'll also offer strategies and activities you can use at home for daily practice, which is an incredibly important part of speech therapy success.